All right, class 62 from OSU, welcome back to Deep Med. You know, the ECG, it's like the heart's own language, right? But let's be honest, under pressure, it can feel like trying to read ancient hieroglyphs. Well, today, we're going to change that. I'm going to give you a foolproof, systematic way to read any ECG you come across. This is going to be your secret weapon for the wards and especially for your final exams. So let's dive right in. Okay, so here's our game plan for today. First, we'll decode the basic language of the ECG. Then, we'll jump into our step-by-step system. Step 1 is rate and rhythm. Step 2 is the cardiac axis. After that, we'll get into the fun stuff, recognizing key abnormalities. And finally, we'll wrap it all up with this super high-yield exam review to make sure this all sticks. This system, it's all about being consistent and accurate every single time. All right, let's kick things off with Section 1, decoding the ECG language. Look, before we can even think about finding what's wrong, we've got to understand what's right. We need to learn what all those little squiggles on the paper are actually trying to tell us.
Okay, first things first, and this is absolutely critical. You have to burn this into your brain. The ECG is a recording of the heart's electrical activity. It's showing you depolarization and repolarization, but it is not showing you the mechanical pump, the actual contraction. Think about it this way. You could have a situation, and you'll see this, called pulseless electrical activity, where the ECG looks totally fine, but the patient has no pulse. Why? Because we're just looking at the wiring, not the engine. This is a fundamental concept, so don't ever forget it.
So when you look at an ECG strip, every single heartbeat is made up of these three main parts. You gotta know these by name. See this first little bump? That's your P wave. Then this big spiky thing, that's the QRS complex. And this last bump right here is the T wave. PQRST. Simple as that. Now let's talk about what they actually mean. So what's happening electrically? Well, that P wave, that's the atria depolarizing, getting ready to contract. The big QRS complex, that's the ventricles depolarizing. It's so much bigger because the ventricles have way more muscle mass. And the T wave shows the ventricles repolarizing or resetting. Now here's a classic exam question they love to ask. Where's the atrial repolarization? The answer? It's hiding. It's such a tiny electrical event, and it happens at the exact same time as that huge QRS complex, so it gets completely swallowed up. You just don't see it. Okay, so now that we know the basic alphabet, let's start reading. And this brings us to Section 2, which is Step 1 of our system, rate and rhythm. I can't stress this enough. You do this first every single time. It's the foundation for everything else you're going to do.
So how do we calculate the heart rate? For your exams, the most accurate way is the 1500 rule. It's super simple. All you do is find 2 R waves in a row. Those are the big spikes. Then you just count the number of tiny little squares between them. Got that number? Great. Now just divide 1500 by whatever that number is. That's it. That gives you the heart.
Let's do a quick example. Say you count 20 small squares between the R waves. So you take 1500, divide it by 20, and you get 75 beats per minute. And since we know normal is between 60 and 100, hey, that's a perfectly normal heart rate. Easy, right? Okay. That was right. Now for rhythm. This is even easier. You're just asking one question. Is it regular or is it irregular? And all you have to do is look at the distance between those R waves, the RR interval. Do they look like they're marching along to a steady beat? Nice and even? That's a regular rhythm. Or are they all over the place, with some close together and some far apart? If it's chaotic like that, it's irregular. And an irregular rhythm should instantly make you start thinking about things like atrial fibrillation. All right, we've got our rate and rhythm. Now for Section 3, Step 2 of our system, the cardiac axis. Now, I know this is the part that trips a lot of students up. It sounds complicated, but I promise you it's not. We're going to use 2 really simple tricks, mnemonics you've probably heard from Dr. El-Sharif, and it's going to make this a piece of cake. Here's the secret. Forget about all the other leads for a second. Just ignore them. We're only going to look at 2 leads, lead I and lead 2. That's it. And in those 2 leads, we're just going to ask, is the QRS complex pointing mostly up or mostly down? It's that simple. So here's our first mnemonic for figuring out if there's right axis deviation. You're going to ask yourself this question. In lead I and lead V2, are they shaking hands? Let me show you what I mean by that. Okay, so this is what right axis deviation looks like. In lead I, the QRS points down. In lead 2, the QRS points up. See how they're pointing towards each other? It literally looks like 2 hands reaching out to shake. And which hand do you shake with? Your right hand. So shaking hands means right axis deviation. Clinically, when you see this, you should start thinking about things like right ventricular hypertrophy or maybe even a pulmonary embolism. But what about the opposite? What if they're not shaking hands?
Well, for that, we have our second mnemonic. Instead of shaking hands, you ask, are they enemies? So for left axis deviation, it's the exact opposite pattern. This time, the QRS in lead I points up, and the QRS in lead 2 points down. See how they're pointing away from each other now? Like two people who've had a fight and turned their backs. They're enemies. And when you see this pattern, you should think about things that affect the left side of the heart, like left ventricular hypertrophy or some conduction blocks. That's left axis deviation.
Okay, awesome. We've got our system down, rate, rhythm, axis. Now we get to the really good stuff. Section 4 is all about using that foundation to start spotting the classic high-yield abnormalities. These are the ones you are absolutely 100% going to see on your exams and on the wards.
Let's start with two of the big ones, aflutter and AFib. For atrial flutter, the dead giveaway is the baseline. Forget about those nice, round P waves. Instead, you get this classic sawtooth pattern. It looks just like the teeth on a saw. You can't miss it. Now, for atrial fibrillation, two things you got to look for. One, the P waves are gone, completely. And two, the rhythm is what we call irregularly irregular. The RR intervals are just all over the map, completely chaotic. Okay, another huge topic for exams, electrolyte imbalances. And potassium is king here. You have to know what high and low potassium look like on an ECG, because they can be life-threatening. So for hypokalemia, that's low potassium, you're looking for T waves that get flattened out, and sometimes you'll even see this extra little bump after it called a U wave. But for hyperkalemia, high potassium, the sign is dramatic. You get these incredibly tall, pointy, peaked T waves. They look like little tents. When you see that, alarm bells should be going off in your head, because that patient is at risk for a deadly arrhythmia.
Whew, okay, we've gone through a lot. So for our final section, let's pull it all together in a super high-yield exam review. This is the stuff you absolutely have to remember when you walk into that exam.
So let's recap the pearls. Number one, always use a system. What's the system? Rate, rhythm, axis. Then look for abnormalities. For the rate, use the 1500 rule. For the axis, what do you ask? Are they shaking hands for right axis deviation, or are they enemies for left axis deviation? Then you look for those patterns. See a sawtooth? That's atrial flutter. See those tall peaked T waves? That's hyperkalemia. Flat T wave with a U wave? Hypokalemia. Stick to that system and you'll never get lost.
So there you have it, a solid, repeatable system. You've got the high-yield patterns, you've got the mnemonics, everything you need. So the next time a resident hands you an ECG on your ward round, or you see one pop up on your exam, you're not going to panic. You're going to know exactly what to do, step by step. Hey, if this system helped clear things up for you, do me a favor and support the channel. Go ahead and hit subscribe, like this explainer, and definitely share it with your friends in Class 62. Our whole goal here at DeepMed is to give you this kind of high-yield content to help you crush your exams. So good luck with everything, and I'll see you in the next one.